Well, welcome everybody. We're so glad that you're going to join us today for our third Thursday IPHA Education Committee. And we're going to dedicate this every month to talking to some colleagues and public health practitioners across the state to talk about successes and some challenges they may have run into to get there. So the point of this is to really connect with one another and learn from each other. And then just strengthen the voice for public health across the state of Iowa. So we're really glad that you're here this week to join us for our first one, and we hope that you'll be back with us again next month. So since today is our first Lunch and Learn, we're gonna have a conversation just about some of the new directions that IPHA is gonna be taking in the future of public health here in Iowa. So to get that started, we're gonna talk to, or get some introductions from our panelists, and they are Abigail Lee and Juan Gudino from the UI College Public Health. Wow, tripping over my words. And we've got Lina Tucker Reinders from IPHA. So if you guys want to just start off by introducing yourselves and telling us a little bit about who you are, your path to public health, and kind of some of your interests here, and we'll go from there. Lina, if you want to start.
I can do that. Thanks, Chelsea. And thank you, Chelsea, also for moderating today. Chelsea is a second-year student at the College of Public Health and has agreed to moderate all of our sessions for us this year.
See in my face a lot.
so we'll have her until May, and it'll be a nice, consistent thread through all of our webinars that we're planning for the year. So as Chelsea said, my name is Lina, and I am the Executive Director here at Iowa Public Health Association. And I've been in public health in a variety of positions for 20 years or so. I started, I don't remember exactly when I learned about public health, what public health was, but I know I always had an interest in health as a career profession. And when I had to drop out of OChem twice, I realized that medical school probably wasn't the route for me. But around the same time, I learned about public policy and the power that has to really impact people's lives and health promotion and prevention, and found myself on a track towards graduate school in public health. So I graduated from the University of Minnesota, and since then, with my MPH in community health education. And since then, I've worked in a variety of settings: local public health, county, state level public health. I've worked for nonprofits. I've worked in global health at the World Health Organization for 7 years, always with a focus on program implementation, strategic planning, health equity. So I would say now in this position, my interests really are in looking at our public health workforce, health equity, really how can we drive conversations towards public health and health equity.
Great. Abby, do you want to introduce yourself?
Yeah, absolutely. My name is Abigail Lee. I am also a second-year MPH candidate at the University of Iowa in their Community and Behavioral Health Department. I am originally from Iowa City, although I went to the University of Northern Iowa for my undergraduate degrees. And I spent time in the workforce and in my training with biomedical research. And so before coming back to graduate school for public health, I learned by finding out what I didn't like and what just really didn't feel quite right for me, much like Lina mentioned with her experience. And that taught me a lot. That made me realize that connection with humans and the things that impact them, their experiences in life, were really important to me. And I actually had a roommate who was a social worker, and I was much more interested in going to events that she had than doing my similarly OChem studying, and that's okay. And so I worked for a number of years doing that, but then also spent time with United Action for Youth in Iowa City, where I learned about their programming with youth. I also became a certified sexual health educator through Eyes Open Iowa through them, and really just tried to start doing public health, even though I was trying to get onto this more formal course. And so I ended up at University of Iowa, and in general, my interests do include sexual reproductive health, stigma, how stigma affects health, social norms, and basically how people interact with society and that influences their health. So thanks you so much for having me today.
All right, and Juan, do you want to introduce yourself?
I would love to, thank you. Hi everyone, thank you for having me. My name is Juan. I'm a second year MPH student studying epidemiology. I also have my woes with OChem. I really didn't enjoy it. So my path's up public health. I graduated from the University of Iowa, and I remember when I was in undergrad, I was set for years to go into pharmacy school, to be a pharmacist for the rest of my life. And I thought I had made that commitment, but just to be sure, I took an internship over the summer, and I was working with a professor who did work with pharmacy. And I found that to put it lightly, I could not do that for the rest of my life. There wasn't the passion, there wasn't the drive, and I felt like my abilities were not being utilized correctly. And so that to me just could not go on. And so I graduated with a degree in psychology. I really was interested in, I didn't know it was health equity at the time, but just understanding the differences, the unequal differences between different social groups in the United States. And I hypothesized or wanted to understand why certain groups were affected with higher rates of disease than other diseases. And I really love statistics and data as well. And so that led me to epidemiology, but also understanding that health equity is important. And so that, I think public health so far has just been a passion for me, and it's really grown. And one of the best things so far that I've learned through the University of Iowa College of Public Health is that it rewards students for having that drive, for having the goals of eliminating health equities and to work collaboratively, and I think that's great. So that's why I'm here today.
Great. Well, thank you guys so much for introducing yourself. And before we get into the rest of this conversation, just a couple of housekeeping items for everyone. Just be sure to double check that your microphone is on mute so we don't pick up any extra sounds. I think we've got all of your video turned off, but just double check for that as well. If you've got any questions throughout the presentation from any of our panelists, feel free to submit them using the chat function. And you can submit them. I'm sharing a screen with Abby, so you can submit the questions to Abby individually, and I'll be able to kind of field those questions and make sure to ask our panelists. So without further ado, we'll kind of get into our conversation, and we really want this to be a conversation between our panelists rather than me sitting here and just asking them questions. They're going to kind of be talking to each other. And so we're going to start off by having Lina just talk a little bit about the vision and the mission of IPHA, and then we'll kind of go from there.
Sure. Thanks again, Chelsea and Abby and Juan. It's great to learn a little bit more about you too. So IPHA, Iowa Public Health Association, we've been around since 1925 is when we were founded. We are a state affiliate of the American Public Health Association, and which means that we can access a lot of the materials that they produce for us, or they produce, and then we can use them as a guide. We also have a voice at APHA. One of our board members is the affiliate representative to the governing council of APHA, which means during the annual meeting in November, she actually is part of the voting governing council for what helps make the decisions for the direction of APHA, American Public Health Association. And so even though we're here in Iowa and we primarily deal with issues that affect us here at home, we do have a voice on the national stage as well, which I think is great. Our mission, the mission of IPHA, is to unite and strengthen the voice for public health in Iowa, and our vision is simply a healthy and thriving Iowa. And there's two words in the mission and vision statement that I want to draw particular attention to. Out of our mission, so our mission is to unite and strengthen the voice for public health in Iowa, and our vision is healthy and thriving Iowa. I like to point out those two words because I think it draws a distinction between us and other organizations. So we are the voice for public health. which means we are working for the public good. We are working for health equity. We are not the voice of public health saying that we are the experts and we are the only ones who know this. So we're not a self-serving organization. We're an organization that works for the public. And so I like that part of our mission. And in our vision, it's inherent that health and being healthy is part of our mission, it's part of our name. But I think what thriving adds to the conversation is that social determinants aspect, the intersectoral nature of public health, the fact that health is created outside of the doctor's office and outside of the hospital. And so to me, a thriving community is one that has strong economic development, strong systems that support public health, our education systems, our transportation systems, labor force, workforce. It's a thriving community, cares about health equity, it cares about those disparities between the groups of people. A thriving community is a place in which we can all live, work, grow, play, and age in a healthy way. So those are the two things that really, to me, stand out in our mission and vision and set us apart from other groups.
Wonderful. And Lina, it's really neat to be able to talk about mission and vision, because I think they're such important parts of organizations. And I'm wondering how you feel about how students across the state fit into that vision. We have a lot of programs, both here at the university, in Des Moines, across the state, that are training students. And so how do they factor in to this vision?
I think it's a great question, and students are a critical part of the voice for public health. Just through your own experiences that you and Chelsea and Juan have shared, you bring different ideas and experiences into public health and where not only public health today, but where the direction of public health can go. And it behooves us to listen to you, to learn from you, and to ensure that you are part of the conversation. Because when we look at the public health workforce and the direction we want to go, it would be a mistake not to include the voice of students and young professionals, because you're the one that's going to be leading us in the future. And so I think that that students today, from what I've experienced, when I interact with students, you tend to get the concept of social determinants of health and the intersectoral nature of our work, of systems thinking, more inherently than your predecessors. And I think like when I was in school, there wasn't a class on systems thinking. There wasn't maybe some public-private partnership stuff, but it was, I'm interested in alcohol, so I take these classes. I'm interested in tobacco, so I take these classes. I'm interested in sexual health, so I take these classes, and very siloed. And of course, now as we head towards Public Health 3.0 and realizing that to make sure our workforce is efficient in our work, that we use public dollars efficiently, that we can really maximize the benefit of the prevention models that we know that work, we have to look systems wide. And I think that your generation is just more in tune with that innately than in the past. And I think that the way you look at things might be different than the way I look at things now. And so we want to include students in our leadership, in our activities, so that we can glean from you some new, fresh ideas that some of us who maybe tend to revert to silos can help expand our vision as well.
Yeah, absolutely. And you kind of started to touch on, what student involvement actually looks like. But I'm kind of wondering how that might differ depending on student perspective. So depending on the background of a student, what might IPHA have to offer to them? We have great differences in urban versus rural perspectives, in students that have been in the workforce and then come back to school versus gone straight through a school program. And obviously we live in a pretty heterogeneous state. And so what about, our future or new public health practitioners and workforce that might not fit, you know, the population that they're serving, how can IPHA serve those students and also organizations that work with IPHA?
Yeah, I think this is a challenge that we have throughout our workforce. We are a statewide organization, so we have members across the state. We have members that work in urban settings, members that work in rural settings, members who work in settings that are as you said, very Caucasian, cisgender, not very much diversity. But then we also have members that are in a highly diverse area as well. And we need to make sure that we are representing being the voice for public health in all those settings. We know that systems change takes a long time, and so that's another reason why I think it's so important to engage students, because hopefully you have a long career trajectory ahead of you here in Iowa. Hopefully you'll stay here in Iowa. And getting students involved early on in leadership positions in IPHA is great to help us go in that direction, to make sure that we are constantly thinking about being intentional in how we address different communities, and making sure that we don't unintentionally serve to widen disparities because we were not intentional in addressing the differences that we see, whether that be urban, rural, male, female, or other gender, across the gender spectrum, or whether that be in public health, governmental settings versus hospital-based settings. There's all kinds of differences that we're looking at, and we want to make sure that whenever we think about something in the work we do, we think about legacy versus tenure. You know, tenure is what we can get done while I'm here. Legacy of it is, of course, what is left behind me. And so I think that students can help guide us towards some long vision, long range thinking in terms of how do we address the differences within our state. And kind of like I said before, I think your generation is just inherent systems thinkers. I think you guys are more easily recognize some of those differences and are more attuned to where we can go. So demographics are changing, and we have to be able to adapt to the workforce as we go. Some of the things that we are looking at, particularly for students, to kind of enhance your experiences across the state and with IPHA. Like I said, we have four standing committees. We have a membership committee, an education committee that's putting on this webinar. We have an advocacy committee, and we have a communication committee. And students who are members are welcome to join any of those committees. They're welcome to serve as co-chairs if they'd like to. So it's a great opportunity for you to put your skills into practice, to share your ideas, to kind of gain some leadership skills as you're building your resume and CV. We are also, one project in particular that we're working on now is we're about to do a public health workforce development survey statewide. And so we'll be looking at what are the current workforce development needs of the state, where are there gaps, and then how can we help fill those gaps. So this is a study that we're working in partnership with the University of Iowa. So we're in IRB approval process right now, and I know you guys know how that goes. But we'll be putting out that survey in the next month or so here. And following the survey of public health professionals across the state, we're going to be developing a public health workforce development task force or work group. It's a lot of works in there. And I would love to have a student representative or more on that work group, because what we're really talking about is how we are going to work as a public health community across the state into the future. And it would be great to have student and young professional voices on that work group, and we'll be developing kind of a task force. The task force will be developing a work plan that hopefully local public health agencies and organizations can then incorporate into their strategic planning to make sure that professional development needs are being met at the same time we meet community needs.
Yeah, absolutely.
And Juan, did you have some questions?
I did. Thank you for Let's see. So I love the idea of networking. I think one of the biggest things in public health that has been hammered to us since our orientation in our classes is the idea of networking, going out and meeting communities and meeting organizers and figuring out how can we be a part and reaching out to those individuals. And that just sounds great. I know a lot of students who would love to be a part of that. And I think a lot of students, like you said, speaking anecdotally, it just appears that in my public health courses versus, when I take human pathology, people just get the idea of health equity more than other education systems. And I think that's a really big strength to the University of Iowa, and in particular, at least from what I've noticed. But my question I have is, what are some goals for the future between IPHA and students of public health that you have? So moving past the database that you mentioned, and what are some other goals that you'd like to see surface and
well, I hope it probably doesn't, or it doesn't come as a surprise that I would love to see an increase in our student membership. And we have public health programs, of course, at the college public health. We have our formal MPH program. We have an MPH program at DMU. We also have public health programs incorporated into other areas of study at other universities, ISU, Drake, UNI, I think St. Ambrose has an undergraduate public health program. So we're getting more and more students interested in public health. And so I would love to see growth in our membership, purely in numbers, but not just in members, but in participation. It's one thing to just sign and say, yep, I joined and looks good. I get the emails every once in a while. But really to take advantage of a membership in IPHA is to get involved. And as I mentioned before, we have our membership committees. Our board of directors is comprised of members. So any member who's been an IPHA member for a year is eligible to run for the board. So we have great opportunities for students to get involved. And it's one of those things where, I told the story when I first came on board back in April, that so I'm not originally from Iowa. I moved to the state 6 years ago. And one of the first things I did professionally was I joined IPHA, because I knew that if I wanted to be part of the public health community, and if I wanted to network and meet other public health practitioners and eventually start working in public health, I needed to be part of that network. So I Googled the Iowa Public Health Association, found the link, joined, and sent an email to Janine Moody, who was the executive director at that time, and said, I'm here, how can I help? And I've been involved ever since. I've done volunteer work, I've done grant writing, I've been on previous webinars, sharing my experiences. And that's what I would encourage students to do as well. And I know you guys are busy. You have tons of classes and homework and trying to figure out kind of where things are in your life and what the next couple of years are going to look like. But if you have time, when you have time to engage, we have, as an IPHA member, you have access to a membership directory, and so you can find out where are people working. If you're from this county in Iowa, you're home on spring break, and what public health people work here. And so you could find that out and go and have kind of informational interview and to find out what people are doing. So that's, informal one-on-one. We also have, I can't emphasize enough joining a committee and being active in the organization, but we also have different events that you can attend throughout the year too. We have, coming up in November, we have a legislative forum where if you're interested in policy and how public health policy and advocacy works at the state level, we have that coming up in December. It's in Ankeny, and we will be talking legislative agendas all day long. That's December 5th. We also have our Day on the Hill, which is February 10th this year. It's a Monday, and people come from all over the state to be at the Capitol and talk to legislators and talk about public health as it relates to legislation. And I know that can be a little intimidating if you've never done it before, but that's what's great about IPHA and the network of members that we have, and many of whom are on the call right now. I have yet to meet a member of IPHA who says, I don't want to talk to other people. I don't want to talk to students. I mean, that's part of the nature of public health. Like you said, Juan, we by nature connect. And so we want to provide the opportunities to do that. It'd be great if we could develop like a student ambassador. So we like a College of Public Health student ambassador that maybe once a month or once a quarter, we kind of host a social gathering where people can come together. We're toying around with some ideas of having kind of monthly coffee meetups or monthly happy hour meetups, to just, again, as a way not to discuss formal projects, but just to connect our community so that we know that we're all kind of working for the same goal and from the same passion. One thing that I will point out directly about students, though, that will probably be of interest to you is that we are, another one of our committees, the membership committee, listened and heard from members that were saying, we have internships and projects for students, and how do we get the word out? And we were hearing from students that were wanting projects and internships outside of where you're studying. And so they've come together and developed a Google form that will be turning shortly into a database. So if I'm working in Cerro Gordo County, for example, and I have an internship availability or a project that could be done, I can fill out this form. It'll populate a database that will be on the IPHA website. And you guys there in Iowa City, or a student in UNI, or here at Drake, or anywhere, can go and say, I'm looking for a project. I'm looking for this. I'm looking for this location, and find out what's available across the state. So we're hoping that is a tool that students will use and access, and as a way not just to get projects and get credit, but to build their networks and eventually help them advance their career. So that should be available by the end of the year.
That sounds great. Lina, I'm sure you have some questions for Juan and Abby, and for people to kind of get to know about the students who are going to be coming up and joining the workforce soon. So why don't you talk to them a little bit and ask them some questions?
Yeah, I'd love to. So we hear a lot about generational divides, like, Gen X, boomers, millennials, and, we all have our kind of little rubs with each other. So what do you guys want public health professionals who've been in the workforce for 20, 30 years, what do you want them to know about you and your cohort?
I can start out. I love that question, because I was I'd say for a class, and there's a lot of Gen Zs in there, and so there's that rubbing sometimes. They talk about like TikToks, and I don't even really know what that is, but I think that one of the biggest things about our cohort is that we are so connected. We are so connected from the farthest reaches of the globe to Hancock County in Iowa to New York City. We have friends everywhere, right? And so I have friends going to schools of public health all across the country. And I think we're all hungry. We talk, we're listening, and we see the issues and we absorb everything. And so I think we're going back to that idea that, we just tend to see health equity or the social determinants of health. We've been living those issues, and we've been trying to analyze and trying to figure out, okay, listening to what, our predecessors of different generations are doing. And I think we're hungry to add. Maybe not necessarily fix everything. I'm not trying to say that our generation is going to be the one to come in and sweep a golden hammer and just change everything. I'm not trying to say that, but I'm just trying to say that we want to help, and we're not oblivious and the issues that exist, and we're willing to do what it takes. That's what I'd like to add to that.
And I think that my thoughts were very much just demonstrated by Juan. I was going to say that we're really excited. I feel really energized, and we were all kind of, as Dr. Deshpande mentioned also in the comments, we're hating on OChem, and there's obviously a place for OChem in public health. We got to have those OEMs.
Just not among us.
Just not among us. But I think the important part to highlight there is that a lot of folks are coming from really different backgrounds. And I think that that is something that has been true amongst generations. I don't want to assert that it hasn't been, but you know, we're accumulating experiences and still saying, no, we are going to keep pushing farther because we're going to find the best niche for what we feel really passionate about and what we are going to shift into no matter what it takes. And so that excitement, the accumulation of really diverse experiences and how it can, again, kind of continue to influence and provide momentum to this intersectionality within public health, to this really forward thinking and in motion instead of kind of staticness that can sometimes happen, especially when things get tough. And so I think that we are looking forward to being in the community. I think that you will find that most students, once they get into a program like this, programs such as the ones at DMU and Drake and the others that we've mentioned, that participating in schoolwork is a really important aspect of what we're doing here. But the number of students who are already working in communities, already involved as if they're on the job already, is really high. And so we are, you know, revving and ready to go.
Well, I think obviously we're lucky to have all of you as part of our profession and as colleagues, and wherever you guys land in the future, they will certainly be lucky to have you all in particular. I'm curious what you mentioned that so many of your fellow students are already working in the community, and I remember the same. And I also remember there being kind of a differential between those who had a lot of community experiences back when I was in school, who already had some of that under the belt, and then students who came directly from undergrad to grad school without some of that experience. And there's different levels of idealism and, you know, and everything. And I'm wondering what, and especially with that, we're in a transition period in public health, and we talk about public health 3.0 and systems change and chief health strategists and all this jargon that we throw out and stuff. And I'm wondering what did you think you were getting into when you got into public health versus what you experienced either in classroom, outside the classroom, kind of where you see public health going? So what's different? What that you, either good or bad, like, or what was unexpected to you, I guess?
Yeah, so I think that for me, it actually worked out kind of along my expectations. I think, you know, I was a student that went out and worked for multiple years in a very different field. And so jumping into public health was jumping into something completely different for me. And I had a number of different anxieties attached to that because it was a whole host of new experiences. But really, it ended up being the right fit. And when it's the right fit, whether you need to go out and work for a handful of years or you know and you're going to go through the program straight away, it was a community. I was looking for a holistic community in my life, and public health has been that, whether it has bred new friends, new colleagues, new ideas, kind of sense of self in a way. And I think that it was what I had been hoping for in that way. I'm still finding that we can potentially reach even, you know, further out of public health to make partnerships elsewhere. I think that some of the things that College of Public Health has encouraged us to participate in, including a global case competition, which is something that they have every year that they host, was, you know, being systems thinkers. And I have found that reaching out to people like urban regional planning, I'm taking coursework in sociology, criminology this year, and in gender and religion, that it also has I sit there and I reflect on how those things factor into public health every time I'm in a class that isn't specifically about public health. And so I would say continuing to build curricula that encourage students to reach outside of the expected coursework or practices or professional development of public health and into these more topical fields that you can then take those practical skills that you're learning and public health information that you're learning and apply a new perspective would be something I would continue to encourage schools to try to do, but also professionals who are already in the workforce. Obviously, I expect that everyone has a very busy schedule, and so continuing education, I'm sure is its own challenge sometimes, but I think that having more diverse ideas of what we call continuing education would be a really great thing.
Yeah, I have to agree with almost everything Abby said. I coming into public health, you know, I didn't realize how far out everything reaches. You know, I came into the College of Public Health at Iowa, and I thought initially I was going to stay, you know, within Iowa. And you know, some people do, and I'm not saying that's a bad thing, but because of networking and because of talking to people with similar interests, I ended up helping with projects in Florida or helping with projects based in California with people who have this similar, you know, public health interests, but I had no idea that that was possible. I had no idea that these networks existed outside of Iowa because I grew up in a really small town of 1,000, you know, it was a rural town in Iowa. And to me, that was the world. To me, that was the extent of the state that we lived in. But I think we can all, one thing that I really gained is that we can all help each other. One of the things that I had the opportunity to do this summer was I was working in Oakland, California, and I was asked to give a presentation to individuals about rural health. And to myself, I don't really consider myself an expert or anything on any field or in any topic. But you know, one of the first questions that we asked was, how many of you have ever been to a rural area? And you know, this is a room of like 20 or 30 people. Nobody had ever visited outside of a suburb or, you know, an urban area. And so talking about it, and it was to me, that is something I would have never expected, right? That we can all learn a lot from each other too. And so I think wherever, if you're at a college of public health, wherever in Iowa, not necessarily the University of Iowa, you have something to offer to places outside of your home state. And if you end up in your home state, you know, it's great either way. So that's what I've learned, and it was really unexpected. So,
Juan, what you said about you know, education being here in Iowa and being able to share your experiences around the country is so true. And having worked in global public health for a number of years, when I was in Geneva and working at WHO, people were surprised when I said I was from Minnesota. And they said, oh, well, we've never met anybody who wasn't from, you know, New York or California or who hadn't been to one of the Ivy League schools or Johns Hopkins or, you know, the Yales, the Harvards, and I was always an advocate for our Midwest schools because we have a lot of expertise here that we need to share, that people need to know about, that we have here, and whether that be rural health or immigrant populations that have come and settled in the Midwest, and how we incorporate and how we incorporate them into our public health planning and welcome them into our communities, and some of the issues that we face. And now we have climate change impacting us, and the flooding and zoonotic diseases and all this stuff. We have a lot of expertise here that is bred and cultivated here in the Midwest, that we have the ability and even responsibility to share around the country, around the world. And so I will always be an advocate for our students being recognized for that expertise, because it was just so frustrating when I was in the international community and we were completely overlooked as part of Flyover Land. And so I think that whatever we can do to help promote our expertise, like you've done in going to California, is just comes back to us tenfold.
Well, we're having a really great conversation, and I hate to be the bearer of bad news, but we're kind of coming toward the end of our hour. So I kind of wanted to ask all three of you a question to kind of to wrap up the conversation we're having here today. And I'm actually going to steal it from Juan because he didn't get to ask it, and I think it's a really good one. So I'm going to pose it to all three of you. And we can start with you, Lina. What do you see as the biggest challenge for public health in Iowa and upcoming future?
I think it's two, and they kind of go together. I think people understanding what is public health, and I think it was Juan that mentioned the breadth of public health. Just today on Facebook, I saw something that next week, DART, Transportation, and the Des Moines Public Library are pairing up. And so if you have a library card, you get to ride the bus for free. It's like, to me, that's public health. I know not everybody else is going to recognize that as public health, but a strong transportation system, a strong public library system, those both connect to the health of our community. And so I reposted that and put their no public health hashtag on that. So just kind of opening up people's eyes to the breadth of public health and how we all work together. And then part and parcel with that is funding for local public health and public health activities and unrestricted funding. Because I think if you were to go to a legislator and say, public health department needs funding so they can work with the library and transportation system, they'd be like, that doesn't make sense. And so educating and advocating for that cross-sectoral work so that it's recognized as a critical component of public health, and also advocating for the unrestricted funds that we need as local public health professionals and agencies to be able to do that population-centered work.
Yeah, I think I certainly, from the training and future practitioner perspective, I appreciate those things because obviously it will impact how we can do our jobs. I think that something that I'm seeing kind of reflected at a national level is how are we communicating with target audiences, with our communities, to deliver the same message in a way that is really going to resonate with them, so that we aren't seeing continued division on topics that really benefit our populations. If we can all accept a version of the same narrative as to why it's important in public health. And I think that obviously that has a lot to do with a number of complex issues in this country right now at the state level. I just think it's really important to keep the dialogue going, to do our best job as public health students and workers, like you're saying, to advocate for public health and to make relationships in unexpected places. Obviously, I said that my personal interests include sexual and reproductive health, but something that I've really seen from that has become more, again, kind of realizing the fact that it's everywhere is stigma, and how stigma affects people all the way from older adults saying that they need assistance and feeling shame for that sense of dependency, to what we're seeing with drug usage, and then sexual health. I mean, there are a whole host of ways that stigma, just the small things that build up that we don't even notice anymore as social norms throughout our Iowan society and beyond, eat away at our progress to get people what they really need to live their best lives. And so that's something that I feel very strongly about, has been a challenge and continues to be a challenge. And I think it's important that we start to look at it more.
You guys give such good answers, and It's hard to follow up on whatever you say. I will say that. This is a hard question. Even I asked it, so, or I wrote it. But I think kind of going to that idea that that you guys mentioned, we working on the systems thinking and trying to make those connections, because if you look at the demographics of our country and of the world, we're growing, we're shifting, our communities are changing, and they're living, breathing things, right? And so I think the biggest challenge would be, how do we respond to those changes with limited funding, with the stigmas that exist? How do we respond to those changes? And so I think that will be one of the biggest challenges coming forth, is just acknowledging that we might not be able to, but still not letting the idea of perfection to be what we're trying to go for, right? I mean, as long as we can do some good in our communities, I think we should strive for that. And so I think that'll be the biggest challenge coming in our future, but everyone has their opinion on that. So
I like that idea of small wins to get us to the eventual goal one.
Yeah.
Well, thank you guys so much for sharing your thoughts today and having this really great conversation. And thank you all for who are joining us and sharing your lunch with us today. We know everyone's really busy, so we appreciate you taking the time to tune in. If you are in the Iowa City area, today's conversation is going to be continuing next month in person. It'll be here at the University of Iowa College of Public Health. Lina is going to be meeting with students and faculty on Thursday, October 24th, and more information will come out about that. We also hope that all of you will join us next month on October 17th, so the third Thursday. We're going to be talking to Black Hawk County Public Health, and they're going to tell us a little bit about systems thinking and what they're doing to better serve their communities. So the IPHA Education Committee is also in the process of planning all the future webinars. So please, if you have any ideas, or if there's something you want to talk about or share with others, just let them know, because they're happy to take recommendations and ideas. And then finally, we have to talk a little bit about how important the mission is that we're doing as a nonprofit organization. And IPHA, really relies on memberships and dues to be able to sustain and support its mission. So if you're not already a member, just please consider joining. Students are able to do that too, and you can talk with your department chair or someone in your program, because we know there's lots of times where they can support membership and have funds available for that. So please just go to www.iowaph.org. Sorry, I was making sure I was reading that right.
IPHA.
Yeah, right on the board. And then, just if you had to leave early, or you want to go back and hear something that was said, we're going to have recordings of all of our Lunch and Learns available on the Iowa Public Health Association's YouTube channel. So thank you guys again so much for joining us, and we hope to see you all next month.
Thanks, everybody.
Thank you. Nice to meet you all.